why is a majority of the country against the health care law passed by the Obama administration and the Democrats? Now, by the way, you can argue that because there's a new Bloomberg poll out saying that basically 58% think that we should keep some or all of the law and that they like large parts of it, and a minority says get rid of it all, right? But there was other polls that said that it's majority unpopular. So, it's a mixed bag, but overall, most of the polling's been against it in its entirety, right? Although people love certain parts of it. Now, why did they lose that battle? Why did the Obama administration lose that in terms of imaging, et cetera? Well, because it turns out there was a tremendous amount of money spent to make sure that people hated this law. In fact, a new New York Times analysis, $235 million spent against the health care law in terms of advertising, and only $69 million in favor of the law. Now, when you break it down, it actually gets worse. Now, you see all the people who spent against it, U.S. Chamber of Commerce, Crossroads, the Karl Rove group, 60 Plus Association is a fake senior citizens group set up by the Koch brothers, and on it goes, right? Now, on the other side, the great bulk of it was the Department of Health and Human Services. And all that is public education ads. So they're not like the political ads like, did you know Obamacare will kill your mother? No, it says law, it does this. If you would like to, check with your doctor, Section 12B says that you can get a free checkup. Like, it's very mundane. It doesn't have anywhere near the power that the negative ads have. So what's happened is the New York Times interviews people, you begin to get a sense of it over and over again. Everybody doesn't understand what's in the law. Why? Because it just had $235 million worth of ads trying to purposely deceive them about what's in the law. So for example, the number one misconception is people think because there's a mandate, if they're, in the lower brackets, middle brackets, etc., they're like, well, I can't afford the insurance. I don't have the insurance because I can't afford it. Obama's going to make me pay for it, but I don't have the money. But actually in the law, you get subsidized. So for example, they talk to someone who's making $35,000 a year. They'd be totally subsidized. So she hates the healthcare law because she thinks she has to put out this money out of her pocket. No, she doesn't get it. She's about to get healthcare for the first time in her life. So if she actually knew what was in the law, she would probably love it. But in reality, she hates it because she thinks it's the exact opposite. Oh, God. And this is what ads do for you. This is how the American people get deceived. This is how they get tricked. Now, there are parts of the law that aren't great, but that's not the parts that the ads talk about. It's not like they're going to be fair and honest with the ads. It's not like they said, hey, you know what, if you make pick a number, 85,000, then you might have an issue with the mandate because none of yours would be subsidized, yada, yada. You can talk about how, the private insurance companies are still in charge and hence they can increase your rates. Those are downsides of the bill that are real. Now, of course, they're not mentioning any of the ads because the private insurance guys are the ones that are running a lot of the ads. So they don't want to blame themselves. They want to make up reasons, like the death panels, etc. Almost everybody the New York Times talked to said, I'm worried about rationing. I had hip replacement surgery, one guy says, the other day. And, I got to pick my own doctor. My God, under Obama's plan, I wouldn't be able to pick my own doctor. And they might not even give it to me because government bureaucrats would decide. But none of that is true. You get to pick your own doctor. There's no rationing. There's no government bureaucrats that say, Bob Jones, you will not be allowed to get hip replacement surgery. It's simply a fabrication. Conservative radio, etc., Fox News, they even came up with this crazy thing about how Natasha Richardson, you remember, she's a celebrity, died skiing. She died in Canada. They made up this thing about, the reason she died was because she was in Canada and they wouldn't give her treatment because of rationing. Oh, it's not even close to true. It's just a gigantic lie. But people believe it. People believe it because you got, not only do you have the over $200 million in ads, but then you got Rush Limbaugh. You got every radio host in the country trying to copy him. You got Fox News Channel. You got all that free media with all of these lies. Well, what are people supposed to think? You know how much the Obama campaign has spent so far defending their law? You're going to love this. $700,000. So less than $1 million versus $235 million. And Fox News and conservative talk radio. Gee, I wonder why people don't know what's in the law. How are we supposed to get beyond that? I mean, this is why I say that campaign finance reform is the only issue in the country. They're going to kill this health care law, whether it's the Supreme Court that does the hatchet job for them, or if Mitt Romney wins, or the Republicans get the Senate or the House. They're going to try to kill this in every way possible. And they might succeed because they have tricked the American people with their lies into believing this health care law is something that it's not. And then, of course, the other part of the poll, by the way, is that what Washington totally ignores, the rest of the media ignores, a huge chunk of the people who say the health care law is not to their liking think it should have done more reform, not less reform. I feel like we're the only country, or only show in the country, that keeps pointing that out. Meanwhile, of course, conventional wisdom marches on. Oh, no, those people, they thought it was too right-wing. No, or too left-wing. No, it's the opposite. They thought it was too right-wing. They want a single payer. They didn't want to be, beholden to these insurance companies who are proven liars.